Is everything alright? Is there something going on in particular?
It's just school.
Just school?
Just school. It's a pain in my butt.
Gotcha. School is very stressful for you. Well, what is your name, ma'am?
Julie.
Julie?
Driver, if you need that.
Yes, that way I kind of get, an idea. So, Julie, what is some of the issues going on with your school? Is it just a lot of hours, or?
It's a lot of hours, and it's a lot of homework, and I'm not sleeping well. I think it's because I'm studying too much, and I'm just tired all the time.
So, have you had any sort of history within your family, for instance, of lack of sleep, lack of
Yes.
Everything like that? So it's very common.
Yes.
And do you think it's because of the stress, just within the family, or just some outside factor? You think
it's just genetic? My grandparents didn't sleep well on my dad's side. My dad doesn't sleep well.
Grandparents.
Mm-hmm.
And you say stressor is pretty much of school, and
yes.
Is there anything outside of school going on that could be effective, or?
Maybe with my boyfriend.
Your boyfriend?
Yeah.
Okay, tell me a little bit about the boyfriend.
He's a really good guy. He really, really is. He treats me good. He treats my family good. Mm-hmm. It's just, he can't make a damn commitment.
Can't make a commitment.
We've kind of tried talking about it, but he just won't make a commitment.
How long have you guys been together?
Almost 3 years.
Almost 3 years. Oh, that would be plenty of time, you would think, but everybody is different.
Yeah.
Has he kind of clarified why he just hasn't wanted to do it or anything?
He has mother issues.
Mother issues?
Yeah. She's a cheating whore.
So I suppose he's kind of fearful in the same position.
Yeah.
Maybe not intentionally, but of course with the situation, you never know what could happen. How are your times growing up as a child, from childhood? Have you always kind of been like this?
Kind of, but it also depends on which parent I'm with mostly. If I'm with my mom, things are kind of on an even keel and smooth and easy to understand and operate with.
Mm-hmm.
With my dad, we're lucky that we made it through childhood.
Have your parents divorced at a very young age for you?
No, they're still together. But it's still, my mom worked a lot when I was a child, and my dad, he worked off and on it while I was in school and as a child. But for, I would say, a good portion of my childhood, he didn't work. So I was left in his care.
So you were always with him?
Basically, yeah. And he would pull some really stupid stuff.
Stupid stuff, I see.
Such as letting us go out on a rig with him where there were rattlesnakes.
Oh, wow. Yeah.
Or allowing us to ride a motorcycle with him even though he didn't have his license for a motorcycle. Just dumb stuff. Bringing in potentially hazardous pets.
Oh my.
Yeah.
Has anything happened out of these instances, like any accidents or anything anything dangerous, too much potentially?
Let's see. I know I've had a broken toe, a broken clavicle, a broken finger while in his care. I have a scar on my right foot from a piece of siding tin that he just left laying around while he was building chicken coops for show animals. And when the chickens got out, and he had these long things called spurs on the back of his feet, and he got me, and I got scars from that. While we were building a barn, there was glass everywhere, and I do have some scars on my knees from the glass.
Oh, wow.
Yeah.
So it's been pretty hard. It's sort of...
I grew up rough.
I can imagine so. Is there anything else you think that could be involved? Are your parents involved with you right now with school?
Yes. Yeah. They are very supportive. My dad doesn't really understand why I'm still going to school. He thinks I'm a professional student.
Unprofessional? What do you define as unprofessional? Or what does he define more or less as that?
I've been going to college since I was 19. And I've gotten several degrees, but I have finally settled on what I want to do, and he's just not happy about
Hmm. He's just kind of ready for you to sort of
Move on.
get to a point.
Yes.
Well, what are you trying to go for?
Personally, I want to work with professional athletes. I want to help them fix what they have screwed up on their bodies, because they're going to need that.
Sort of like,
A personal trainer kind of.
exactly, yeah.
Yes.
Yeah.
But also, the way that I look at it is, why would you hire someone as a personal trainer when they couldn't also be your nutritionist and your chef? And I've already gotten a degree in culinary arts. If that makes sense. I mean,
Right.
hiring one person is better than hiring two.
Of course. Might as well get professions in multiple things. I mean, that's always good, but, do you think that is sometimes too much for you?
No, because right now I'm not using my culinary skills to do much of anything. I cook at home, that's about it.
I see.
My school schedule is just too tight for me to try and cook.
And how much further along do you need to be going to get a degree in helping with
Kinesiology.
sports
Sports and exercise science.
Mm-hmm.
I will be done hopefully next fall.
Hopefully.
Hmm. It depends on a lot of things. Right now, my dad is out of work, and they were helping me financially pay for school. And if I may have to cut back on my hours.
I see. Yeah. I mean, do you have a job along with?
Yes, I do.
What do you do?
I work as a fitness instructor already. I work over in Midland at a place called COM Aquatics.
Oh, okay. Yeah. And I see they do pretty good things there for anyone there.
I mostly work with the geriatric clients. So, and being around them sometimes, it's wonderful because they smile and they make me smile and we joke around and everything. But it's just so heartbreaking when you hear one's in the hospital with pneumonia, somebody's had to have back surgery, a car went through somebody's house and catapulted them down the hall.
Oh, wow.
Yeah.
So you're hearing pretty much like everything there.
Yeah. And it's so hard to help them understand, well, you have to go slow, you've been injured. And they're going, no, I'm used to doing this. I'm so used to doing this. I just feel like I'm useless sometimes when I can't get them to understand why I'm telling them to go slow.
Right. So it's like you're trying to tell them with emphasis, hey, this is important, but it's easier said than done with some people. Some will listen, some won't. You said you've been feeling very down lately. Like,
yes.
How long have you really felt this way? Do you think?
Maybe about 3 weeks.
So 3 weeks, you believe?
Yeah.
I mean, have you felt like, maybe within, say, a few years you felt like this? Or is it just more or less of a recent?
It does cycle. I have good times and I have bad times. More good than bad.
Well, that's good. I mean, at least you know. I mean, we do ask these questions out of, kind of purposes, to make sure everything's good and everything. You haven't thought of any suicidal thoughts?
Only as a young child.
As a child?
Yeah. And a teenager. Lately, no. There's no reason.
There's no reason for it?
It's stupid.
I mean, I agree.
That's the coward's way out.
Coward's way out, I see. And we always ask kind of for purposes of, you're aware of your being and everything, what is, where are you at right now?
Right now, I think I'm about at a 2 on the hearer level. Right now, I'm just like, I really don't know why I'm talking to a psychiatrist. I don't know why I need to be here. I'm fine. People need to quit worrying.
Well, I mean, if you're always down about this, and like you said, this has been going on for some time now, it is a big concern, especially, I mean, you're saying you have more good and bad in your life, of course, but then when you're not acting like it, it must be something more to it aside from it, so.
Well, I think that mostly it's the job. Working with the elderly, it just really, it can bring you down. When you can't get them to understand what you're doing. And you can't get them, and you lose 1 or 2 or 4 in a few months.
And then you just kind of get that sort of stress on you, like, I just lost somebody that I was helping with, Kind of like in a doctor, when they deal with patients and stuff, and they lose patients and stuff, but, seems to have been in the wrong field, but, I mean,
well,
it happens, of course, right?
Well, when you're working with one of the ladies that needed help getting to her car in a gust, I know that a gust of wind was not my fault,
Right.
but I wasn't able to catch her to keep her from hitting her head on the pavement. And she did. I mean, I felt so bad because I thought that was my fault. And the next day, I was so sick because of that. I felt physically ill because I had not been able to help her more.
Let's see. And with a lot of these moods and everything, with everything from what I'm seeing anyway, we would usually diagnose patients like this along the line, usually along with depression. Um, some of it's, like I said, with the questions of the suicide and everything, a little more hardcore than others. Some, like I said, they actually go follow through on those attempts of suicide and everything. And, like you said, you only had thoughts of it as a child and teenager, but then outgrew them, which is a very good thing, by the way.
Well, I think mostly it was because I had a couple of really bad relationships in high school and thought that that was the end of the world.
Oh, yeah. I mean, that kind of does tend to wonder, because when you're in high school, those are like the best 4 years of your life, supposedly.
No, they're not.
Right, of course they're not, no.
No.
And that's only just 4 years of your life, and people take them more to heart, of course. But, how's your boyfriend been supporting you through your situation?
He is very supportive. He has decided that during a lot of my studies that if I need help, such as with my anatomy and physiology, he's like, what's this?
Okay,
And
so
I'm
he
just
helps you
like,
study.
yes.
Good.
And he's very willing to let me poke and prod and stretch and move and everything on him, so I understand how things are supposed to go.
I see. Very good. So
he's very understanding and he's very, very supportive.
Mm-hmm. I mean, does he have any stress in his life you think that could be interfering with certain things, like, like your commitment for saying?
His mom is a cheating whore.
Right.
We've already covered that. His dad has had esophageal cancer when he was a child that I know of. And sometimes it comes back. I mean, he has flare-ups with acid reflux.
Mm-hmm. Oh, yeah.
And that's part of what caused it in the first place.
Mm-hmm.
So he helps take care of his dad. He helps with his grandmother, who lives right next door to his dad. He still lives with his dad, which I don't blame him. But he's also a type 1 diabetic.
Oh, wow. So you hear quite a bit on this place.
Yeah. And he's scared to live alone because if he doesn't get up at certain times to eat, his blood sugar drops too low. If he doesn't do certain things, his blood sugar spikes too high. And it's just, he has scared me once or twice because his blood sugar has dropped and I didn't exactly know what to do.
I see.
Let's rephrase that. I didn't have the glucose tablets in my purse like I was supposed to.
Oh, gotcha. So it's kind of like, just having that fear set, oh, what if we're not always prepared?
Right.
Go figure. Mm-hmm. But, I mean, like you said, everything's kind of been just maintained, just very, I don't want to say down about it, but not where you want to be.
I'm just here.
Right. You're just
I'm
here.
here.
And, with a life in your case, I mean, you sound like you are aware that everyone else has lives that are, I would say much worse than yours or something, or much better or whatever. Like, oh, I'm not in the worst position in the world, but you feel like you are.
Yeah.
Right.
Once again, working with the elderly, I just feel like, I don't need to get too close because I'm going to lose them and it's going to hurt me more than it's going to hurt them.
I see. Well, what are your thoughts of, like, taking medications for something like this?
As a teenager, I did take one medication to help get over some of my problems. I believe that it was,
Some antidepressants are very common.
Yeah.
I've heard of Cymbalta, I've heard of, no.
No. It was a little blue pill.
Blue pill?
The blue pill. I'll think of it here in a minute.
Oh, okay. Probably. Well, like you said, you took medication as a child, or about your teens, so, I mean, did you have to take them for long, or are you still taking them?
Well, and I also took Ritalin as a child. I do have ADHD. And that started causing allergic reactions and nightmares and night terrors
Oh my.
and some hallucinations. So I took myself off of that.
Good. So like, I mean, you're, you know, from the meds, if it's not helping you, don't take it, of course.
Right.
You know, we do have other varieties and other methods of, you know, like treatments, and
Yes.
you know, as I have experience with someone else before, like they would take, you know, Cymbalta as sort of a helper, sort of a minor thing, along with, you know, um, like thyroid medication, birth control,
Right.
trying to maintain on their, you know, life expectancy situations such as their hours in school, such as their hours at working and everything, sort of balancing things out.
Yeah.
You know, which is easier said than done, of course. But,
Oh yeah.
you know, but like I said, if there's any particular thing you have in mind, like some people are against the idea of medication, like utterly, but I mean, you know.
I am not against the idea of having medication.
Mm-hmm.
If I have to, that's fine. If I don't have to, that's fine. I am very good about taking my medication when I have to. I try not to miss any pills because that's just stupid.
Oh, of course, yeah.
I learned that really quick in high school with that antidepressant because, yeah, whew, that was not good.
Like, was there just a lot of bad reactions to it?
If I missed a pill, the day was just terrible. I would get in trouble. I would not be able to sit still because I just wanted to get up and leave the classroom.
Mm-hmm.
Or I would end up going for half a day and then saying, screw it, I'm done. I'm tired of this. I'm walking home.
Gotcha.
Or I would call a parent and make them come get me.
So yeah, definitely meds for you. No, okay, no.
Oh, thank you so much.
No, that's understood though. I'm aware that, you know, it is a big issue, schematics of having to balance out, you know, needing to take meds versus not needing it, you know, and then what could help as well is like if you were to say to be on an antidepressant, but then, you know, you don't need it after a while, you feel good after a little bit, then, you know, you'd be weaned off and maybe taking less of a dosage per timing. That way you're not cold turkey.
Right.
Cold turkey can be just as bad as, you know, like you said, not taking it. So,
Yeah.
you know, there are suggestions out there, but yeah, so.
Well, doing the Ritalin cold turkey was not fun. 6th grade was not fun when I did that.
Oh, my goodness, you got quite a bit there, huh? It's a bit of a history.
Yeah.
Alright, well, for our session for the moment being, I think, you know, we've kind of come to a setting point. You have a lot of stressors in your life that are kind of affecting you in a way that, you know, you're still getting the good support system you need. You're still, you know, I mean, nothing is badly affecting you because, you know, like say your parents are being abusive or something like that. They're not being abusive or anything to cause you to be this way.
It's me.
Yeah, well,
it just happens.
of course.
So.
I mean, you know, and then when you feel this way, you don't want to feel this way.
No,
So.
this is not fun. This is not who I want to be. I don't want my nieces and nephews to remember me being Debbie Downer.
Understood. I would agree. I completely agree.
So, at least I have more than 7 people to say, I need medication for.
Oh no, I mean, you know, and like we said, you know, and if we can get you on the least amount of things possible, on the least dosages and so on and so forth, then it makes you feel great, fantastic, you know. So little by little, we'll make this work for you.
Okay.
So we'll set up like another appointment or anything like that, of course. And if you have any questions for me right now?
No. Not at the moment. I can't think of any.
Okay. Well, you know, you also have my number and everything for my stuff, so there's that for you.
Thank you.
Yeah, and if you need to call me anytime for any issues or if anything changes, let me know, and, you know, we'll get you some of those ideas for meds and stuff as soon as we can, and we'll get that ready for you, okay?
Okay, thank you so much.
No problem.